Now, South African scientists are currently investigating a highly plausible hypothesis, and the emergence of new COVID-19 variants could be linked, in some cases, to mutations taking place inside infected people whose immune systems have already been weakened by other factors, including, but not limited to, untreated HIV. Researchers have already observed that COVID-19 can linger for many months in patients who are HIV positive, but who, for varying reasons, are not on treatment. For more on this, we are joined by medical doctor, Dr. Edward Sepirwa. Thank you so much, doctor, for your time, and good morning to you. Let us just start off with this particular research. What are we finding around the situation of untreated HIV patients or people and the COVID-19 pandemic?
So the research is actually quite fairly new. Remember, the Omicron virus is only emerged close to just a month ago. So that's when all of these variants of concern, scientists had to stand up and now start researching what's really actually behind this mutation of the viruses. So there isn't enough data that we have actually now, or anything that one can actually report on. But already there was a study in Stanford which has started months ago, which is actually focusing on cases of such nature. There was a lady that was admitted in one of the Stanford campuses who was actually in critical care, had an uncontrolled HIV, and within the 15 days that she was there was a repeat mutation of the virus itself. And there was something of concern. So that's why basically things started that can be now looked at. That with those ones, their focus is on the Omicron itself, since it's a current variant of concern, or a problematic variant in the country, or in the world rather. Sorry. So currently there isn't much to really comment on. We just let the study go by, but other considerations are there, and variables that will be put into the study of other things that can actually be of influence in any of those patients. Because looking at this, it's an issue of a virus that will be in the body for a very long time, and then it gets that breeding ground for mutations. So currently there isn't much to really comment on. We'll just be waiting as they release or as they update us on the study itself.
Now, this then goes back to the importance of those who are HIV positive taking the required medication, doesn't it?
It's very important. Yes, one thing we need to remember right now is COVID-19 is a virus that's highly dependent on a patient's immune status. So a weak immune system can lead to severe disease or death. A weak immune system can actually save you. A strong immune system can help you clear the virus effectively. Or a strong or overactive immune system can actually kill you. That's what we call a cytokine storm. And that's why we give you, or patients are being given steroids, which actually calms down the steroid, which calms down the immune system so that you don't overreact and now you get a severe disease from the virus. There's already enough controversy with regards to COVID-19 stigmatization and HIV stigmatization, where they have great social impact in a community. With enough HIV stigmatization, discussions that we'll be making rather now, we also need to remember that there are other diseases of concern or conditions of concern that can actually lead to poor immune system. Just that HIV is one of those, or one of the main ones that we know that they directly impact your immune system. Bone marrow diseases, severe obesity, diabetes mellitus, autoimmune diseases, cancers, chronic steroid use, all of those things can actually give an eye that Africa bears higher consequences or impacts of HIV epidemic in the world, with now having more than 8 million people in a population of just above 60 million, and actually having new infections, like 500 infections in South Africa daily. So when COVID-19 got in the space, HIV programs from prevention to actually critical care of HIV patients were highly neglected. So now we need to really refocus and continue with the programs, start the new ones that we can, and revive our awareness. And now actually better improve on those, because there are many advantages that actually came with COVID at some patient. Now Moderna will be developing an mRNA vaccine, which they actually got better confidence from trying to discover one of the COVID-19 vaccines.
Now, Doc, you mentioned that there isn't much currently when it comes into the investigations around how the variants are treating patients with untreated COVID-19. But there was an initial concern when COVID-19 hit the world around those who actually have underlying conditions and people who actually are HIV positive.
Okay, so what we're saying is the problem here is an HIV positive person, right? They have a lower immune system, right? Of which they would need the immune system to what? To counterattack the virus as it attacks the body. So you get the infection, then because of a lower immune system, to clear the virus stays in your immune system for a longer time. With the virus staying in your immune system for a longer time, that's when you get an accumulation of mutations. After accumulation of mutations, then those lead to variants that will then emerge, which will differ in character, higher transmissibility, higher disease severity, and that virus then now gets strategies to.
All right, it seems we have lost our doctor, Dr. Edward Sepirwa. We are having a conversation with him around the issue of how COVID-19 variants can actually affect those that are untreated HIV patients. Let's go back to that conversation with the doc. And doctor, from what you are saying, I'm understanding that there could be long COVID then for those who have untreated HIV.
Oh yes, there could be a long COVID. One of the long-standing cases, the patient that actually tested positive for COVID for close to 8 months. I think it was 216 days. And with that patient having that long COVID rather.
Doc, would need you to please unmute yourself. It seems you've muted.
Hear what I'm saying. So our focus is when there's a long-standing disease, but it's actually the symptoms of the COVID itself that will actually be lingering. Because with some of these patients, you can have the symptoms lingering for a longer time, but actually you test negative for COVID. But with some of these people, what happens is the disease stays in the system for so long that there was the lady I'm talking about, more than 200 days testing positive, and there were actually close to 30 genetic shifts that actually happened. So what we'll say is that we're expecting that untreated HIV patient would actually have a virus staying longer in their system.
Thank you so much. That is the voice of medical doctor, Dr. Edward Sepirwa, just giving us details around the issue of course, COVID-19 variants and how they are working with those that have untreated HIV.